Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Vivek Mahajan. I am an interventional cardiologist practicing at Fortis Hospital, Kalyan, and I have my own clinic at Dombivli where I do diagnostic tests for heart. And today I shall be talking about a silent epidemic that India is combating, and that is heart failure. But the problem with Indian heart failure patients is that the majority of the heart failure patients in India are surprisingly young individuals. It's a common occurrence in India to witness young adults seeking medical assistance for heart failure. This is in contrast with the Western countries, where heart failure is predominantly a disease of the elderly. Now, let us break down the heart failure into five essential insights. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get diagnosed with heart failure, they think that it's the end of their lives. The term heart failure by itself seems so frightening, but in essential it means that your heart is not doing properly what it is supposed to do. And what is the heart supposed to do? It is supposed to pump blood efficiently. The efficiency of the heart is measured in terms of ejection fraction. Ejection fraction is the amount of blood that the left lower chamber of the heart pumps into the major arteries of the body. Usually, the left lower chamber, that is the left ventricle, pumps around 50 to 70% of the blood which it contains. And therefore, the normal ejection fraction is 50 to 70%. In heart failure individuals, usually the ejection fraction is below 40%, which means that the heart cannot efficiently pump out the blood that it contains to supply the various organs of the body and leading to a condition called as the heart failure. There is also a condition called as heart failure with preserved ejection fraction, where the ejection fraction is normal, that is 50 to 70, but still the heart cannot efficiently pump the blood to the various organs without causing disturbances like breathlessness to the patient. So heart failure in essential is inability of the heart to perform its job perfectly. Now, the second thing that we should know about heart failure is why are so many Indians affected by heart failure? For this, we have to blame the genetics. Indians are genetically more vulnerable to cardiovascular diseases like coronary artery diseases, wherein people get heart attacks, which damages the heart. And why do many Indians get heart attacks or coronary artery disease? The answer again lies in our genetics. Indians are genetically more predisposed to have disorders like high blood pressure, diabetes, obesity, dyslipidemia, and on top of that, habits like smoking and alcohol, lack of exercise worsen this genetic problem. Now, the third thing, what we need to talk about heart failure is the signs and symptoms of heart failure. The signs and symptoms of heart failure are obviously those resulting from inefficiency of the heart. It could be general weakness, easy fatigability, palpitations, it could be shortness of breath, it could be swelling all over the body, it could be swelling in the liver, which leads to nausea and vomiting. There could be loss of appetite and a weight loss as well in these patients. The most important question, and that is our fourth insight, is that how do we protect ourselves from this dangerous disease? Our heart works incredibly hard to keep us alive, and therefore there are five golden rules which we can follow to return the favor to our heart. First is to have a good, healthy, balanced diet. Second is to exercise daily and regularly. Third is practice stress management and get adequate sleep. Fourth is avoid alcohol, tobacco, and smoking. And the fifth is early detection of heart failure through regular blood tests. And the last thing, what we need to know about heart failure is what comes after the diagnosis of heart failure. So, heart failure, as I said, is not a death sentence. It is a difficult disease to treat, yes, but we have number of medications. With progress in the medical science, we have number of life-saving therapies now available for heart failure. It is possible to lead an enjoyable, meaningful, and productive life even after heart failure diagnosis. We have medications which can increase the lifespan of the patient, which can help the patient to lead a near normal life like any other normal human being. If the medications do not work perfectly, then we have adjunctive therapies like biventricular pacemakers, implantable cardiovascular defibrillators, and heart valve repair or replacement. And last resort of heart failure therapy is heart transplant or artificial heart. So these five things will help us debunk the myths around the heart failure. The lifetime risk of heart failure is 1 in 5 for both men and women. The risk is real, and therefore awareness and proactive measures can help us in tackling this epidemic of heart failure which we Indians are facing. Thank you.